What is it like to have a beautiful new smile? Well, Joe Cronauer asked someone who is very happy to share her story and her new look.
We're spending some time today not only with Dr. Stephen Marsh from his office there at Cedar and Brainerd, just off of I-271, but he's got a special guest. Dr. Marsh, who do we have today?
So, Joe, thanks. We have Lydia, and Lydia's a special young woman. She's a student at John Carroll. She's offered to share her story, but we became very close friends over her treatment time, and she was here today, and we thought, let's bring Lydia on to tell her story, because hers, I think, will be very interesting to both you and to your viewers.
Well, Lydia, as you're about to tell the story, we're going to show a picture of you with your phone and the way you used to look. Check this out. All right. And this is the way you look now without a mask on. My goodness, that smile is $1 million right there. Oh my goodness, look at you. Lydia, tell us your story.
Yeah, absolutely. So that is so funny to me because it's been just over a year. I had a lot of troubles with various dentists, just struggling to find the right person who's going to understand sort of the difficulties I had with my teeth. And so I came to Dr. Marsh really anxious and really nervous, but the team and Dr. Marsh himself have made me feel so welcome. And we created, a treatment plan that really worked for me. And now I have this beautiful smile that I'm so excited to show off. And I get to, feel really confident. And, going to the dentist is fun, which I never thought I would say, but I'm more than excited to be here when I am.
That's awesome, Lydia. Doctor, tell us about the transformation and Lydia coming into your office, what you saw you had to deal with, and where you took her to.
So over the years, Lydia had ground her teeth down, and so they were short. Joe, we actually take measurements. Her teeth were about half the size of somebody who's in her 20s, and usually there's a reason. Sometimes it's food acids. Oftentimes it's from grinding, it's from stress, that sort of thing. Anyhow, her teeth had worn down and her tissue had grown over the teeth. Some of that happens when people have orthodontic treatment. One of the things that was really important, because she felt so, I'm not sure insecure is the right word, felt bad about her teeth. And she said when she had seen dentists in other offices and other people, they had made her feel bad, as if it were her fault. And generally, it's not a fault. It literally is something that happens over time in her case because of the grinding bruxism. So we were very non-judgmental with her, as we are with other people, to say, here's where we are. How can we move forward? How can we get her a wonderful result? And then once that result is achieved, how can we protect that so she has a lifetime free of any dental care?
Well, I appreciate that very much. And, Lydia, you became the new Lydia, if you will, with the smile, last September. So you had a year to flash the smile, maybe 6 months before you started covering up with a mask and all that. Tell me about that first time when you did that. I mean, it had to be invigorating.
Yeah, absolutely. It's crazy that it was such a quick change, but it was such a lifelong coming change, to be able to just smile and not, try and cover it or feel insecure was crazy. And now, it used to be something that I never wanted to talk about, but now people are like, oh my gosh, how do your teeth look so good? And I'm more than excited to tell them, oh my gosh, well, it's Dr. Marsh and his team who gave this to me. It's that.
Well,
what happened.
It's wonderful. And if you want to realize what Lydia has realized now and be a part of the team, the family that Dr. Marsh and his team can help you with, the transformation is just a phone call away. That's where it starts. 440-461-1003 or the website clevelandsmiles.com. Lydia, thank you so much for sharing. And Dr. Marsh, thank you and your team for all you do.
Oh, it's my pleasure. And I, as you suggest, I want to thank Lydia. Actually, Joe, she was here for another appointment this morning for some other work, so she's numb. So the fact that she was able to articulate it so well, despite being numb, is also a credit to the young.
Very well done, Lydia. Very well done.
Thank you.